Thanks for tuning in to this episode of Watson Clinic Health Talk. Our guest on this episode is Dr. Guillermo Vasquez, a board-certified internal medicine specialist who treats patients from our Watson Clinic South location at 1033 North Parkway Frontage Road in South Lakeland. Alongside his talented care team, which includes registered nurse practitioners Emily Barriswill, Brandy Plummer, and Jennifer Potts, Dr. Vasquez offers a full range of primary care services, including comprehensive guidance on diet, exercise, ongoing disease prevention, and chronic care management, which makes him the ideal guest as we begin a new year, as so many resolutions revolve around these very same topics. Appointments with Dr. Vasquez or any member of his care team may be scheduled by calling 863-680-7190 or by visiting watsonclinic.com/Vasquez. Well, first of all, thank you for being in today, Dr. Vasquez.
No, thank you for having me.
I wanted to bring you in because it's the month of January. Lots of New Year's resolutions, many of which deal with health-related issues. Do you find a bump in appointments around January for that reason?
Yeah, we do see, hey, I want to start an exercise regimen. I'm looking to see what I can do to help myself lose weight. I'm looking to see what I can do to try and improve my quality of life, my quantity of life, so on.
So let's take these one at a time. I know you and your whole team, you have a great team of nurse practitioners. All of you offer weight management, obesity medicine, those types of services. What do those services entail?
So it depends on what the patient comes in looking for. If they're looking for guidance as far as lifestyle modifications that don't necessarily require medication interventions, we review those sort of things as far as like target exercise regimens. We review options as far as going over to more dietary guided sort of things. We review things like Jenny Craig and LA Nutrisystem and Weight Watchers options and all the things that come along with those things. And then some people do come in with, like I said earlier, more of the, hey, what can I do as far as exercise? What are my targets? What are my allowable heart rates? What is the, how is it that these things work as far as what will do what for me? So, for example, there's been lots of talk about changes in guidelines as far as exercise regimens. Some people are still of the old mindset of, well, I just want to do my steps and that's all I'm going to do. And unfortunately, it's not that easy. Yes, steps make a difference. Being sedentary versus being active to some degree does change things, but intensity does matter as well. Being aggressive with aerobic activities is not all that there is. And there actually were some guidelines recently that came out as far as that no matter what, you should have some degree of muscle training taking place as well. So providing that kind of information before the medications, I think, is very important because you want to make, it's not just a matter of looking good, it's feeling good and being here where you can take care of yourself, not be dependent on somebody else taking care of you as well.
Yeah, I remember the guidelines used to be something like 150 minutes of rigorous activity every week, which came out to something like 30 minutes for over the course of 5 days, something like that.
Yeah, and they changed that you can do mild to moderate and then moderate to more aggressive activities, but on top of that is that increase in muscle training, and I think that part of that is in response. This would be my guess that I think that some of it is in response to some of the things that we're doing on the medication side, right? For example, there was some information that came out on the injectables that actually showed that people of advanced age, I'm not going to give a number because I don't like the numbers that are given, but people that are older, yes, they lose weight, but they lose the wrong kind of weight because unfortunately some of these appetite suppressing medications make you lose not only fat, but they make you lose muscle as well. So that intensity of muscle training has to be done at the same time, because if you don't, you end up having this higher risk of falls and fractures associated with using just the medications. And the last thing you want is, yes, I'm skinny, but guess what? I can't move, or I'm about to fall every time I try and move.
Right.
Right. So that has to be part of the conversation that takes place. And unfortunately, it doesn't always happen that way, because some of these online things that take place, some of these providers that aren't actually seeing their patients, they're just going online and doing these sort of things. They're just like, here's your shot, see you in a month. And that's not, you have to treat the whole person. You have to make sure that they're going to be able to take care of themselves, be able to get off of the chair, be able to walk around with their grandkids, do things with their children, so on and so forth. It's not just a matter of looking skinny, it's a matter of being healthy at the same time.
I want to get into medications, but one more question about exercise. I know it depends upon, you do a consultation with the patient, you'll evaluate them and their particular needs, where they're lacking. But in general, what are some of the most effective and productive exercises that you can do?
I know I keep giving stipulations because it is a person-by-person basis, right? So the one that's going to give you the most bang for your buck as far as longevity of life is going to be all the lower body exercises. So walking, running, if you can get there, biking, are going to be the longevity of life sort of things. Now, I'm not saying that everyone has to do those sort of things, because you can do the same lower body exercises by doing yoga, Pilates, which will kick your butt, even though it sounds like it's lightweight. But anything that does lower body is what's been shown to be more longevity of life. Now, the pretty exercises, all the upper body stuff, it's not that there's anything wrong with them. It's that they don't have the same longevity of life sort of thing.
Okay.
And because as we get older, all of us are at risk for falls, and we want to keep that from happening. There was some study, I can't remember where I saw the study. They actually had this thing where they actually went through the exercises and they showed where each exercise falls as far as longevity. And it isn't running, it isn't biking, the ones that I just tried to sell you on. It actually ended up being tennis. And it's because tennis is a balance training exercise, right? You're using your lower body, but you're practicing balance exercises day in, day out whenever you play. And it's not that hard pounding that you're doing with the running, right? So it's not beating up your joints. And don't get me wrong, tennis is hard, but as you age, your partners are probably aging, and therefore you're doing different kinds of activities. So I find it interesting that some of this pickleball fancy that's going on,
right.
I wonder how that's going to fall in that curve, because you're not moving on a big court, but it's balance training, right?
And tennis also supplies great cardio.
Oh yeah, yeah. I mean, it all depends on when you start and how hard you go. I mean, but it's that, and it does cover that long, the duration of time as well, because you're constantly being active. One of the other things that I encourage for people that have some of the hard times, as far as like the ones that require, impact, is swimming. Swimming's non-impact, full body exercise. And it doesn't have any of that issue. And fortunately, we live in a typically warm state with heated pools and so on and so forth, so you can do that. And water aerobics is awesome. They even have water cycling available at the local, like Kelly Rec has water cycling and so on. So just anything that gets the lower body is what I tend to encourage. And just think about this, right? If you try and look at your body composition, look at the size of your arms versus the size of your legs, right? No matter how big you think you can get those arms, you're never going to beat the size of your legs that you can build those up to, right? And part of what we're looking for is to try and make it so that when you have, you're not even necessarily working out, you build up those muscles so much that, guess what? You're burning more energy sitting around at the computer maintaining that muscle mass in your legs versus trying to maintain that muscle mass in your arms, right? So it's that basal metabolic burn is what we're trying to build on a long-term basis. Because yes, you burn calories when you exercise, but that's not the point. The point is to build up your metabolic, requirements so much that when you're working, when you're sitting, those muscles are demanding that constant burn to maintain everything they have going on.
Those are great suggestions. You mentioned sitting at your computer or at work or what have you. I would imagine that being sedentary is the major villain when it comes to maintaining an active and healthy level of fitness.
Yeah, and I mean, and we've gone to the point of society that lots of us do have that as part of our daily requirements. But you can even do little changes there. I mean, having a stand-up desk makes a difference. Now you can do a little bit of balance training. You can do a little bit of maintenance of exercise when you're doing activities. I have patients that I have them purchase under desk pedals. Emily, one of my nurse practitioners, is really good about. She has a walking treadmill underneath her desk. She's just constantly moving. That constant movement just burns. Getting those steps will make a difference.
Yeah.
It's just that little bit of things all add up.
And with diet, when you counsel a patient, do you review what their current diet is and what they're missing from it and how they need to make adjustments?
So, yes, I think that's part of the conversation that needs to take place. We all have different, appetites, different meals, and so on and so forth. And I think that we can get away with different kinds of intake as long as you're looking at the total calorie count. There was an interesting guy that actually what he did is he went out and tried to lose weight, just proving this point. He tried to go and lose weight by doing different things. He actually went out and purposely lost weight only eating McDonald's. But it's because his overall caloric intake was less than what he was eating before he did this thing. This same guy did the thing like losing weight eating Twinkies. And it's like, seriously, why would you do that to yourself? That is not at all what I am encouraging. This is unhealthy options, but it's all about calorie totals, right? They changed. Everyone, I think we both probably grew up on that old food pyramid thing.
Right.
No one ever followed that because it was just too convoluted. They actually, interestingly, changed this thing, I don't know, like 16, 20 years ago. They actually changed it where it became a plate, right? And what they did was they got a plate and they divided it in half and divided it into quarters after that, right? So half of that plate should be leafy green vegetables, right? It's just essentially what you're doing is you're giving yourself enough volume that you're filling yourself with the stuff that's actually good for you, right? Now, that does not include all the fun stuff. It does not include corn. It does not include peas. It does not include, these high starch, high starch vegetables. And it's because they're just lots of calories. Now, that other quarter of the plate is a sensible carb, so about the size of your fist, and then a sensible protein. Now,
like chicken and fish
exactly,
and that sort of thing.
You want it to be the lean stuff, not the fun stuff that we've been doing to ourselves for X number of years. Those are more as treats, not as staples. So lean cuts. Going back to what you said, it's using more the fish, the chicken, avoiding the greasy stuff, avoiding the skin of the chicken, avoiding the skin of the fish. You're still allowed your red meats. It just needs to be the lean cuts, not the ribeyes and so on and so forth. And it's not that I'm saying never have these. I'm saying be careful with how often you're having these because of other issues beyond the calories associated to them. I've had these conversations where patients are like, but Subway. I'm like, yeah, but look at the size of that thing. It's at least 2 portions of carbs, right? And then what are you putting inside those 2 portions of carbs? You're putting mayonnaise and you're putting in processed meats. And
more marinara on your meatball.
Exactly. So it ends up being this question of, yes, is that maybe better than eating the full foot long? Yeah, obviously you're decreasing your calories, but you need to count that against another part of the day.
Yeah.
Because, using that going back to that plate thing, you have 3 carbs portions per day. Don't get slick and put a roll on the side. That counts as your carb. And be careful with the liquid the liquid calories, right? All the sodas, all the juices.
Yeah.
It's
That's
bunch
a big
of
one.
sugar.
Yeah.
It's not what we were designed for, right? We're meant to have water. And we're meant to have things that aren't, processed, and we aren't having. Unfortunately, it's just, I get it. It's easier to grab that Coke, but it's not meant to be what we subsist on.
Well, Moving on to medications, because that's a big subtopic when it comes to weight loss nowadays, and there's more and more options medication-wise, and I'm sure there are going to be a lot more coming soon. How do you view treating obesity through medication?
I think that it's an option that needs to be taken in consideration with lifestyle changes. Depending on only the medication thing is not something that is healthy for you on a long-term basis. The medications that we tend to use nowadays, just because of demand and because of response, are the injectables that you probably have heard about. Right? So these injectables, there's different theories behind the way that they work, but overall, for most patients, what it does is just makes you feel full sooner and feel full longer, right? So when you have that occurring, then overall caloric intake is going to go down. Now, I'm not saying that that's the only way that it works. There are other chemical pathways that are being affected, but for the sake of ease, that's the biggest conversation that we have. So you take this medication, makes you feel full, makes you feel full longer, therefore you stop the snacking, stop the overeating, and so on and so forth. I mean, some of the original medication on this stuff, it was so bad that, that clean plate club that we were all brought up with when we were younger, it's no longer a thing because you will pay for it if you try and overeat. I mean, you're like, but there's only 2 more bites. No, you're full. Stop it. Because if you don't, you ended up with the older medications, nausea and vomiting type of thing. The newer ones, fortunately, don't have that degree of intensity of response, but it will remind you, hey, that's enough. Don't have any more. And what because you're able to get away with that decreased intake, you have the overall decreased caloric intake, therefore more caloric negative burn. So you're having more of a net negative overall is what I'm trying to say.
Okay.
So, the injectables have long-term benefits of other things. They actually have some studies, interestingly, that came out with heart protection associated to some of them. Some of them have kidney protection associated to them as well. But it goes with that same stipulation that it plays. We talked about a little bit earlier, that you have to be cognizant of the potential consequences. The medications aren't without risks, and going over those risks with your provider is important. There are things that you need to watch out for. So, for example, some of them are actually linked to an increased risk for pancreatitis, and that could be a pretty significant consequence if you aren't aware of it. Some of the other options are non-injectable medications, and actually one of the manufacturers of the injectables came out with an oral version of one of them, which showed that it actually does have weight loss associated to it, and hopefully that'll be the promise that we're looking for, because lots of people are
I think that's where it's going. Yeah, I've been reading more and more about that.
Yeah, the new one that's coming out is going to be something that will probably have more people paying attention to this as another option. Unfortunately, though, one of the things that can happen with any of these is cost limitations. They're not the cheapest things to come out, and some insurances cover them, some of them don't, and it all depends on what you're covered with as to whether or not you get them.
And another thing on obesity, which will lead into another subject I want to discuss with you, it's just the benefits of maintaining a healthy weight. I mean, it protects you against quite a few risk factors for chronic disease.
Yeah, very much so. Although not, something that can be directly, it's not a one-to-one thing. It increases the chances of diabetes, increases the chances of high blood pressure, increases the chances of having, heart disease, increases the chances of strokes. It's not a this, therefore that, but there's definitely some connection and correlation between the two as far as the likelihood of recurrences. So it's not just the cosmetic components that you're trying to protect yourself from. And actually, because you mentioned this, there actually are some medications that have been approved for protection from sleep apnea, for example. One of the medications actually has that indication. We've had patients that have gotten it approved by the insurance because of that indication. So it's working in that regard to decrease the likelihood of progression of sleep apnea, which has its significant consequences.
So one of the medications intended primarily for weight loss has the side effect of.
Yeah, it actually has been shown. It has been approved for protection of sleep apnea.
Okay.
So it actually decreases the likelihood of issues associated to it. Type of thing.
Speaking of chronic conditions, another major benefit of maintaining regular visits with a primary care physician and the care team, they can keep you up to date on screenings that test for chronic conditions. Give me some of those milestone markers that people should consult their primary care about.
So primary care physicians, it's a gradual process that takes place as far as with age. So some of the things that we usually screen for is just blood sugar issues. So diabetes is part of the screening guidelines that take place. Watching your cholesterol numbers take place. Liver markers take place. And I'm trying to focus on the weight stuff on the front end because all of those things can be affected directly by weight components. But as far as general screenings, yes, I mean, beyond that, it's just monitoring your regular blood counts, checking your status as far as screenings based upon sex guidelines. So pap smears can be done by your primary cares, referrals for colonoscopies, colon cancer screens, referrals for mammograms, all the things that would take place on an ongoing basis are things that you should keep up with.
Yeah. And the best thing about being a part of Watson Clinic is when you have to refer someone to another specialty, they're all right here in the network.
Yeah, I mean, it definitely makes it easier for all of us to be able to see each other's information, to be able to share all the stuff across our systems. I think that there's definitely a culture of sharing as much as we can for the patient's benefit on our end. I think that one of the deficiencies that we have with outside systems is that we don't always get the information that we need, right? So getting that, just because it pops to mind, getting that diabetic eye exam from LensCrafters is much more difficult than just going down to our optometry and ophthalmology department and we have it the same day.
Right.
They'll give us the information over and we can see what it is that's going on with your eye exams.
Wow. Yeah, that coordination of care is really a convenient benefit of seeing physicians here at Watson Clinic. Tell me a little bit about your team, because I know you're proud of them. I know that they're fantastic providers.
Yeah. So I have 3 nurse practitioners, Emily Bearswell, Brandy Plummer, and Jennifer Potts. We work 6 days a week. We work from 7 to 6 Monday through Thursday, 7 to 5 on Fridays, and we're there from 7 to 11-ish on Saturdays. We try and make sure that our patients have the coverage that they need. We work in our patients. If I can't see them, usually one of the women can see them. We have the ability to see Spanish speakers. I speak Spanish. Jennifer speaks Spanish. We work as a team. We don't have assigned patients, and that is done on purpose. I want everyone to know everyone because, if one of us is out, the other one of us can cover. I still direct admit to the hospital. I see my patients in the hospital that are admitted to my service. I've had a few people that, come in with situations where one of the nurse practitioners doesn't see them and we're right across the hall from each other. And I'm like, okay, well, sorry, you have to go to the big house. We have to put you in, but I'll be seeing you tomorrow morning, or one of the nurse practitioners will be seeing you on the weekend with me to make sure that everything is going the way that we want it to go. I think that expanding with those hours to be able to meet everyone's needs is the biggest strength that that I think that we bring. I think that unfortunately we all have other commitments besides ourselves. Mm-hmm. And making time for yourself is as important as it can be, because if you're not healthy, how can you keep everyone else healthy?
Yeah, well, I think our discussion today, it's really shown that it's important to go see a primary to maintain good health. But I know a lot of people also rely on their primary for sick care when they get sick. So working as a team, as you guys do, that allows you guys to have same day availability many times for sick visits and that sort of thing.
Yeah, I mean, our use of not only Epic but also our phone center, our call center and everything, they know that we will work our people in. If it requires for us to stay late, we come late. We'll stay late. If we have to be there early, we're there early. I mean, there's been times where I'm seeing people at 6:45 in the morning, then at 6:30 at night, just because I want to make sure that everyone gets seen that needs to be seen.
That's it for this episode of Watson Clinic Health Talk. Appointments with Dr. Vasquez or any member of his care team may be scheduled by calling 863-680-7190 or by visiting watsonclinic.com/Vasquez. To hear previous episodes of our podcast and to subscribe for free wherever you get your podcasts, visit our website at watsonclinic.com/podcast.